The backbone of medical coding lies in comprehending CPT codes. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will explore the procedure code of perineum, the next anatomical site of CPT anesthesia. Time to dive into the world of the code exploration. Perineum, the next anatomical site of CPT anesthesia. Perineum is a tiny patch of sensitive skin between genitals, vagina opening, or scrotum and anus, and it is also the bottom region of pelvic cavity. First code is 00902, anesthesia for anorectal procedure. Ano mean anus, rectal mean rectum. The provider perform anesthesia services for a procedure involving the anus and rectum. Next code is 00904, radical perineal procedure. The provider perform anesthesia services for a complete removal of all diseased tissue of the area around the genital. Next code is 00906, vulvectomy. Vulva is a global term that describes all the structures that make the female external genitalia. Ectomy means removal. The provider performs anesthesia services for a patient undergoing excision of external genitals of the female. Next code is 00908, perineal prostatectomy. The provider performs anesthesia services for a patient undergoing the procedure in which the surgical provider partially or completely removes the prostate gland by approaching it through the perineum. Next code is 00910. Anesthesia for transurethral procedure including urethrocystoscopy not otherwise specified. It means the anesthesia service is provided for a patient undergoing procedure in which the surgical provider may examine the organ of urinary system by inserting a special device through the urethra, which is the external opening for urine outflow. This code is for procedures not specified by any other anesthesia code. Next code is 00912, transurethral resection of bladder tumors. The provider performs anesthesia services for a patient undergoing excision of one or more tumors within the bladder performed through the urethra, which is the opening for outflow of urine. Next code is 00914, transurethral resection of prostate. The provider performs anesthesia services for a patient undergoing removal of prostate gland through the urethra. Next code is 00916, post transurethral resection bleeding. It means the anesthesia service is provided for a patient requiring bleeding control following removal of specific tissue accessed through the urethra. Next code is 00918, with fragmentation, manipulation, and or removal of urethral calculus. Calculus means stones. The provider performs anesthesia services for a patient undergoing fragmentation, manipulation, and or removal of urethral calculus. The surgical provider accesses the ureter through the urethra, breaks and or manipulate the stones within the urethra, and may take the stone out. Next code is 00920. Anesthesia for procedures on men genitalia, including open urethral procedure, not otherwise specified. It means the provider performs anesthesia services for a patient undergoing a procedure on men genitalia that is not specified by any other anesthesia code As a part of procedure, the provider may incise the urethra. Next code is 00921, vasectomy, unilateral or bilateral. The provider performs anesthesia services for a patient undergoing the procedure in which the surgical provider excises the vas deferens, which is a duct that carries the male reproductive cells towards the penis. The provider can perform the procedure unilaterally with removal of vas deferens of one side or bilaterally involves the vas deferens of each side. Next code is 00922, seminal vesicles. The provider performs anesthesia service for a patient undergoing a procedure related to seminal vesicles, which are glands secreting the components of semen. Next code is 00924, undescended testes, unilateral or bilateral. During pregnancy, a male baby testicles develop in the abdominal cavity. In most cases, they drop into the scrotum before birth. Testicles that do not drop are called undescended testicles, which may require surgery. The provider performs anesthesia service for a patient undergoing a procedure on undescended testes for one or of both sides. Next code is 00926, radical orchiectomy inguinal. Orchi means testicles, inguinal means groin area. The provider performs anesthesia service for a patient undergoing surgical removal of one or both testes by an incision made into groin area, typically for malignancy. The surgical provider also removes the spermatic cord. Next code is 00928, radical orchiectomy abdominal. The provider performs anesthesia services for a patient undergoing surgical removal of one or both testes, typically for malignancy, along with the spermatic cord and nearby abdominal lymph nodes. The surgical provider performs the procedure by incision made into the lower abdominal area. Next code is 00930, orchipexy, unilateral or bilateral. Orchi means testicles, pexy means fixation. The provider performs anesthesia service for a patient undergoing surgical treatment to move an undescended testis one or both sides into the scrotum. Next code is 00932, complete amputation of penis. Amputation is the loss or removal of a body part. The provider performs anesthesia service for a patient undergoing complete amputation or surgical removal of penis, comprising primary erectile tissue. Next code is 00934, radical amputation of penis with bilateral angular lymphadenectomy. The provider performs anesthesia service for a patient undergoing extensive amputation or surgical removal of the penis, along with the removal of lymph node of the groin on the both sides. Next code is 00936, radical amputation of penis with bilateral inguinal and iliac lymphadenectomy. It means the anesthesia service is provided for a patient undergoing extensive surgical removal of the penis along with the removal of lymph node of inguinal and iliac region on both sides. Next code is 00938, insertion of penile prosthesis perineal approach. A penile prosthesis is an artificial cylinder that fills with fluid to allow the penis to become hard for an erection. The provider performs anesthesia services for a patient undergoing the procedure through the perineum for the penile prosthesis insertion, a procedure performed to treat erectile dysfunction in men. Next code is 00940. Anesthesia for vaginal procedure including biopsy of labia, vagina, cervix, or endometrium not otherwise specified. It means the anesthesia service is provided for a patient undergoing procedure or female perineum, including biopsy of labia, vagina, cervix, or endometrium. Use this code for the procedure not specified by any other anesthesia code. Next code is 00942. Colpotomy, vaginectomy, colporrhaphy, and other urethral procedure. The provider performs anesthesia services for a patient undergoing procedures on the female vagina and associated structure, including biopsy, incision into the vagina, repair of vaginal tear, or excision of the vagina, and open urethral procedure. Next code is 00944. Vaginal hysterectomy. It means the anesthesia service is provided for a patient undergoing removal of the uterus through the vagina approach. Next code is 00948. Cervical circlage. Cervical circlage is the way of keeping cervix closed during pregnancy to prevent premature birth. The provider performs anesthesia services for a patient undergoing a procedure in which the surgical provider uses sutures to close the cervix in the pregnant female who has incompetent cervix to prevent premature delivery. Next code is 00950. Coldoscopy. The provider performs anesthesia services for a patient undergoing a procedure in which the surgical provider views the uterus by introducing a flexible tube with a viewing camera. Next code is 00952. Hysteroscopy or hysterosplyngography. Hysteroscopy is the exam of the inside of the cervix and the uterus using a thin lighted flexible tube called hysteroscope. Hysterosplyngography is an X-ray procedure that is used to view the inside of the uterus and fallopian tubes. The provider performs anesthesia services for a patient undergoing either hysteroscopy or hysterosplyngography or both. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my giving email